Good morning, ladies and gentlemen. It's an honor for me today to stand in front of you to deliver a presentation. The topic of my presentation is hypertension. As we know, that hypertension is a medical term for when the body's blood pressure exceeds normal limits, commonly known as high blood pressure. Blood pressure is divided into two parts, namely systolic and diastolic. Systolic pressure is the pressure when the heart pumps blood throughout the body. On the other hand, diastolic pressure is the pressure when the heart relaxes and receives blood before pumping it back throughout the body. Hypertension is a condition when systolic pressure is beyond 140 and the diastolic pressure is beyond 90. Hopefully, the presentation will make people aware that hypertension is a disease that must be watched out for, especially in older people. In this presentation, I will cover three main points. The first type of hypertension, second reason, and the third consequence. So that would be the overall structure of my presentation. And now let's move on to the first point. First, I would like to talk about first type of hypertension. The first, primary or essential hypertension. This type of hypertension will appear gradually over the years. The cause itself is due to genetic factor or an unhealthy lifestyle that a person lives. Most people who have this disease show no symptom at all. In fact, the symptom will appear similar to other medical condition. Second, secondary hypertension. Secondary hypertension is a type of high blood pressure that occurs due to other medical conditions that the sufferer experience. Several conditions that trigger primary hypertension include number one, adrenal gland disorder such as Cushing syndrome. Number two, kidney disease. Number three is taking drug. Number four is sleep apnea. Number five, correction of the aorta. The next have thyroid and parathyroid problem. Next, three is prehypertension. Prehypertension is a health condition that occurs when blood pressure is higher than normal. Number four is hypertensive crisis. Hypertensive crisis is type of hypertension that has reached a severe stage. Namely, if blood pressure reaches 980 or 902 or more. Number five is hypertensive urgency. When hypertensive urgency occurs, that suppressed blood pressure will be very high, more than 180, but there has not been any damage to the organ in the body. The sixth is hypertensive emergency. Hypertension emergency is a condition that occurs when blood pressure is very high and has caused damage to the body's organ. The symptoms themselves generally include shortness of breath, chest pain, back pain, numbness, change of vision, difficulty speaking, or seizures. Now let's move on to the next topic, namely the causes. Number one is consuming too much salt. Too much salt in the body will increase the amount of sodium so that the kidney will have difficulty eliminating fluid and cause accumulation. Number two, excessive stress. The body handles stress by releasing the hormone adrenaline and cortisol, which increase heart rate. So the more stress a person, the higher that heart rate will be. Next, lack of physical movement. Lack of physical activity can also be a further cause of hypertension because the heart rate tends to be faster during activity and trigger high blood pressure. Number four is obesity. Obesity is the accumulation of excess fat which can narrow blood vessel, making it difficult for the heart to work, making it susceptible to the risk of hypertension. Number five is addiction to smoking. Nicotine levels can damage artery walls, artery wall so that the vessel begin to narrow and trigger hypertension. In the long term, insufficiency will cause severe damage to various organs. And the last topic is a consequence of hypertension. Number one, heart attack, heart failure, aneurysm, peripheral artery disease, mild stroke or tension ischemic attack, stroke, brain aneurysm, decreased memory, eye damage, kidney disorder, metabolic syndrome, and sexual dysfunction. Ladies and gentlemen, I think that's the end of my talk today. To sum up, there are three main points. The first one is first type of hypertension. The second is the causes of hypertension, and the third point is consequence of hypertension. Thank you for your attention. Good morning.